Good afternoon, and thank you for joining us for today's COVID-19 update. The situation in Alberta continues to evolve rapidly. The latest global tracking data from Johns Hopkins University indicates that the total number of confirmed cases at more than 190,000. 155 countries have been affected. There have been over 7,500 fatalities and 80,600 people have recovered. Later today, Dr. Hinshaw will provide updated case numbers here in Alberta. Around the world, a variety of dramatic measures are being implemented to contain the spread of COVID-19. The situation is very serious, and we are taking action more effectively to protect Albertans against this pandemic. Last night, we held a meeting of our Emergency Management Committee of Cabinet, which authorized me to use all powers necessary to keep Albertans safe. That's why today I am announcing that Alberta is declaring a state of public emergency in response to COVID-19. This declaration is meant to empower authorities under the Public Health Act to more effectively manage the pandemic response. Decisive action is needed, and we are taking that action. The Emergency Management Committee of Cabinet met again this morning, and in response to the escalating numbers of infections, Dr. Hinshaw and her team have also recommended new measures on social distancing to contain the spread of the virus, and the Government of Alberta has accepted those recommendations. So in addition to declaring a public health emergency, the Alberta Government is moving forward with aggressive new measures to contain the virus. Any organized gathering of more than 50 people are to be cancelled immediately. All Albertans are prohibited from attending public recreational facilities and private entertainment facilities such as casinos, bingo halls, bars, theaters, and children's play centers until further notice. They are also prohibited from attending recreational facilities, arenas, science centers, museums, art galleries, and community centers, fitness centers, and entertainment facilities. Conferences, worship gatherings, and family events with more than 50 people, such as weddings and funerals, should also be cancelled. I also want to be clear about what will not be impacted by these measures. This order will not apply to healthcare facilities, to this legislature, to grocery stores, airports, and other essential services. Nonprofit, community, and religious soup kitchens will also be exempt from this order, as will homeless shelters. We're working with our homeless shelters on protocols to help to prevent and contain any prospective infections. Additionally, sit-down restaurants, not including buffets, pubs, delis, and coffee shops will be allowed to remain open at this time, but they will be limited to a maximum of 50 people or 50% of their authorized capacity, whichever is lower. This is the same protocol adopted by the Government of Quebec this week. Drive-through, takeout, and delivery will still be permitted. In fact, the government today has changed regulations to allow restaurants to engage in off sales of liquor to help them liquidate their inventories during this very challenging time. I recognize that these measures will have a profound impact on the lives of Albertans, but they are frankly necessary in the face of this growing pandemic. Alberta's Chief Medical Officer of Health is also advising all Albertans to take appropriate steps to socially distance themselves from others during their day-to-day lives. Around the world, a variety of dramatic measures are being implemented to contain the spread of COVID-19. That has meant social distancing and self-isolation, depending on individual circumstances. We have committed to ensuring Albertans that will have all of the guidance and support they need to meet this unprecedented moment in our history. This means acting quickly to address the indirect impacts of the spread of COVID-19 by supporting vulnerable Albertans in particular. To assist Albertans affected by COVID-19, we are dedicating an immediate injection of $60 million to support civil society organizations, charities, and nonprofits, helping folks under isolation to cope with this crisis. These funds will be dispersed before the end of this fiscal year, in other words, before March 31st, And just today, I chaired the inaugural meeting of the Premier's Charities Council. I've also appointed as Parliamentary Secretary for Civil Society Jeremy Nixon, former Executive Director of the Mustard Seed, to work with our charities and nonprofits to ensure that they are helping to reach out to seniors and other vulnerable people in particular who are in self-isolation. Half of the funds will be dedicated to immediate support to homeless shelters and women's shelters to address a range of needs. Funds will also be available to address staff shortages due to self-isolation and potential additional space requirements due to public health recommendations and associated staffing. A second aspect of the funding will provide broader support to civil society organizations. $30 million will extend support services to seniors and other vulnerable community members who are isolated due to COVID-19 or otherwise impacted. They will require additional supports and services as they respond to the need to self-isolate. We will disperse these funds through the Family and Community Support Services to organizations that are already providing services in the community, like Meals on Wheels, and other organizations, as well as helping to deliver, for example, prescriptions to those who need them. The Cabinet today also approved a range of emergency economic measures, which we'll be announcing shortly, perhaps as soon as tomorrow. Lastly, under the leadership of Deputy Minister Paul Winnick, the Provincial Operations Centre has moved to Level 4 of emergency preparedness and has increased staff and resources accordingly. I visited the Provincial Operations Centre last night and was impressed with the dedication and hard work of the professionals involved from across different departments, agencies, levels of government, including industry and civil society. Once again, I want to assure Albertans that the entire government of Alberta is totally focused on dealing with this crisis. This is a serious moment in our history, and COVID-19 will test all of us. But I know that this province is resilient and we are ready for the test. I have full confidence in our public health and safety officials, and we will continue doing everything in our power to contain the outbreak and to keep Albertans safe. We'll do whatever it takes to slow the spread of this virus, we've already begun planning for the recovery of our economy following the impact of this crisis. I'm happy to take your questions.
What enforcement tools do you have at your disposal for anyone who does not follow these new rules?
Well, it depends on the rule, but with respect to limitations on bars and nightclubs or restaurants, for example, that would be up to local health officials to enforce those rules under the kind of delegated authorities. I note in Calgary already they brought in a limitation of 250 people in bars or restaurants or 50% of their licensed capacity, whichever is lower. We've just reduced that to 50 people or 50%, whichever is lower. We've closed nightclubs and bars. We will allow sit-down restaurants to continue operating on a limited basis, at least for the time being. Again, it would be civic public health officials who are primarily responsible. I should say that Deputy Minister Whittick and Dr. Hinshaw are available to answer technical questions as well afterwards.
We're still seeing cases in some grocery stores of hoarding. Some stores are putting in limits. Is there anything you can do about that? And I know that some seniors can't get the supplies. What would you recommend, Alberta?
Sure. First of all, let me say I've spoken to the Retail Council of Canada. I've also spoken to the president of Walmart. And we've had communication from Loblaws, which is a large, as you know, grocery chain. All of them assure us that they have all of the supplies that are necessary to fulfill demand for the future. That there is no, that supply chains and food security are not compromised. And so there is no need for people to engage in hoarding or panic buying. We do recommend that people have enough food on hand to cope through a couple of weeks, given the likelihood that many people will be affected by self-isolation for 14 days. But there is no logical reason for people to go out and buy weeks and weeks or months of supplies. And I want to commend the growing number of retailers who are offering golden hours of set-aside shopping time, typically in the morning with fully stocked shelves and freshly cleaned stores, to allow seniors to go in and in a more controlled environment get what they need. So I would ask all retailers to consider having a dedicated, safe, and orderly time when seniors and the vulnerable can access what they need. We're also, as I've said, working with charities to see if they can help to step up deliveries, complimentary deliveries to the homes of seniors for pharmaceuticals, cleaning equipment, food, and other necessities. But as I say, the Provincial Operations Centre is closely tracking supply chains, and their advice to me is that there is no reason to be concerned about the integrity of food supplies or other essential goods.
You mentioned this was done in large part to more effectively manage everything. Where have the shortcomings been? Where haven't you been able to manage it that you feel the state of emergency will allow you to do better?
Well, the state of health of emergency under the Public Health Act adds an additional range of authorities to the government and to the chief medical officer. We have been briefed that the single greatest concern in the future in coping with the peak time in the pandemic will be around the availability of trained personnel. And we need the chief medical officer and Alberta Health Services may need extra authorities for scheduling, perhaps to bring back people who are medical professionals who have retired recently, or to cancel vacation time. So these are the kinds of authorities that are presented in the Public Health Act through a declaration of a public health emergency that will give certainty of our ability to provide the medical care that Albertans will need. I think everybody understands that in a pandemic such as this, we expect a significant peak at a particular time. And the challenge of every government, every jurisdiction, is to try to keep that peak below the maximum capacity of the health system. At the same time, we want to expand the maximum capacity at that peak point, and that's where these powers could be useful.
Are those powers then limited to, under this state of emergency, limited to the health system, or are these for?
Yeah, there's a separate emergency power under the Emergency Measures Act, which we are not invoking today. We may decide to do so in the future. That has a much more expansive range of authorities, including the ability to prevent people from leaving the province or entering the province, the ability to seize property. For example, it's conceivable that if the pandemic goes in the wrong direction, that we may need to effectively use hotels to house people for quarantine, for example. So the Emergency Measures Act would give us those authorities. We do not believe that they are currently necessary, but I've told officials that if they believe we need those powers, they should recommend it, and we will invoke that.
How do hotels play into today's announcements?
Well, hotels per se are unaffected unless they're operating licensed restaurants, I should say, that are regulated restaurants, in which case they will not be allowed to accommodate more than 50 guests or 50% of their authorized capacity, whichever is the lower number. I would think that their function spaces, again, they'll be limited to 50, so there may be bookings for marriage, for weddings or conventions. Those are now being scaled down to meetings of a maximum of 50 people. In terms of their accommodations, those should continue unaffected. And so in fact, I just got off a call with a number of key industry organizations, including the Alberta Hotel Association. I think they understand that.
And you were just mentioning that hotels might be used for quarantine in the future. Have you guys already had chats?
Well, that's been in the long range pandemic planning of the Government of Alberta to always look to contingency plans for overflow capacity to keep the hospitals safe. If something like this does reach that level, so that there's already been advanced planning in that respect. And I suppose if there's good news here, it's that there's a lot of available hotel space right now should we need it.
I'm going to go to the phone operator. Can you put through the first caller, please?
Our first question comes from Rick Bell of the Calgary Sun. Your line is open.
Good afternoon, Premier. just two quick questions, or one question and a supplementary. Your decision today, why now? What is it about today, or what is it about the evidence that you've seen that causes you to make the decision today as opposed to either not make the decision today or have made the decision perhaps earlier? What happened which caused you to say that we've got to do it today?
Well, first of all, Rick, as you know, we've seen a significant increase in the number of confirmed cases of COVID-19 in Alberta this week. You'll be getting a further update from Dr. Hinshaw on additional cases later today. So we see that Alberta seems to be following the same general trend line as many other jurisdictions, which means that we have to take more aggressive measures to contain the spread of the virus, more aggressive social distancing measures. Also, we came to the conclusion today that it was probably inevitable, given the direction of the disease, that we would end up invoking a public health emergency in any event. And so we concluded that it was prudent to do so now, while we are still at the relatively early stages, so that our the managers of AHS and the folks who are coordinating the emergency response know that these authorities are in place. I note that the governments of Ontario and Saskatchewan, I believe New Brunswick, have also declared public health emergencies. That is in part because I gather they found some difficulty in scheduling. And they've had some folks refusing to wear personal protection equipment. And they also found that in some cases collective bargaining agreements were limiting their ability to schedule people in the health system. We have not found those constraints yet, but this is a case of us being well prepared for what is coming at us.
Follow-up, Rick?
And just as a supplementary, when exactly do the new rules come in, particularly for bars and casinos? In other words, when do bars have to shut down? When do casinos have to shut down? Is it today, tomorrow?
Immediately.
When is the shutdown order?
As soon as the Lieutenant Governor signs the order in council that I've authorized, I authorized that this morning at about 11:30, and the Lieutenant Governor should be adding her approval to that order in council immediately. We will, and so we would. This is effective immediately. It's effective today, and we apologize to operators of these establishments for the suddenness of this. Although I think they've seen it coming. In fact, I was just talking in our consultations with industry leaders with a gentleman who said that he closed a bar that he owns yesterday because he saw this coming. He wanted to get ahead of it. And I know a number of other operators have done the same. I know that Cineplex closed all of their cinemas yesterday across the country. So I think these are thoughtful business people, and they have a firm grasp of the obvious.
Operator, can you please put through the next caller?
The next question comes from Tyler Dawson of the National Post. Your line is open.
Hi, folks. I just wanted to ask about whether or not these closure rules affect churches or any other sort of houses of worship.
They do, and Dr. Hinshaw was very clear about that in a measure that we adopted on the weekend, which removed the exemption for places of worship from the limitation on public gatherings. At the time, the limitation was 250 people. As of now, we have reduced that to 50 people, and we've removed the place of worship exemption. We believe that faith communities can find other ways to gather to address the spiritual and pastoral needs of their members. They can do online liturgies and worship ceremonies, and certainly I'm sure that pastors and clerics and volunteers will be increasing their visits to the isolated and to the elderly in particular, who may be in greater need of spiritual and pastoral support at this time. We are making an exemption from the 50-person limit for charities, nonprofits, and religious organizations that operate community kitchens such as soup kitchens. So they'll be able to continue to provide that essential support to the least fortunate.
Do you have a follow-up, Tyler?
No, I think I'm good. Thanks.
Great. Operator, can you put through the next caller, please?
Our next question comes from Chris Marco of the Calgary Herald. Your line is open.
Hi, Premier. I'm wondering, with this order today, what kind of assistance are you going to help the restaurants, the bars, the recreation centers, and other businesses that are being impacted and obviously are going to have some cash flow problems?
Yes, there will be a range of measures announced by the Government of Alberta this week to help with the urgent need for cash liquidity for those businesses. And so that will be the first package responding to the economic aspects of this crisis. So please stay tuned. That announcement may be as early as tomorrow. We're just finalizing the details around this. Please understand that all of this is happening we're working as quickly as we can, quite literally overnight, all night Sunday. Officials from the Department of Finance, for example, stayed up to draft statutory amendments to the Appropriations Act to add the additional $500 million for the public healthcare system. So our officials are working as quickly as they can, but there will be a number of measures that will constitute financial relief for businesses, at the very least a series of deferrals. We are also in constant contact with the Government of Canada about measures that they will be announcing. We are grateful that the Government of Canada has injected an additional $10 billion into the Business Development Bank and Export Development Banks to provide a backstop to facilitate additional access to credit for businesses affected by COVID-19. But we are certainly looking at a series of measures that include tax deferrals for business taxes, income taxes, property taxes, WCB premiums, and other measures.
Do you have a follow-up, Chris?
Yes, you also mentioned earlier that you're already putting together plans to get the economy going once this crisis passes. Can you provide any, details on what that might look like or any additional color on it? So
we're working on our recovery package, and as I said in Ottawa last week, it seems to me that as a rule of thumb, we should be looking at additional fiscal stimulus equivalent to at least 1% of GDP, which for Alberta would be in the range of this would be $3 billion to $3.5 billion. So that's our current planning target for fiscal stimulus. The problem is this: we're not in an environment where conventional countercyclical fiscal stimulus will work in the same way for a couple of reasons. First of all, there is disorder in the markets. As you know, on Sunday, the Federal Reserve reduced its prime lending rate to 0, and yet the Dow responded with a 15% decline on Monday. So markets are clearly unstable. Secondly, with so many people in self-isolation and in quarantine, with so many industries that are effectively suspended, an effort to inject demand into the economy is likely to have a modest effect at this point. So our current state of mind is to focus our short-term efforts on liquidity for both households and businesses. That includes income support for people that have to leave work. And then the second phase would be more conventional fiscal stimulus. That will involve a major cash injection into building infrastructure in this forthcoming building season, and a number of other measures that we are considering.
Operator, can you please put through the next caller?
Our next question comes from Emma Graney of the Globe and Mail. Your line is open.
Yeah, g'day, Premier. Thanks for taking my question. I've got a question here about what does this mean for officers and workers, and that also leads to another question about government workers, why they were told to come into work. So do offices have to close if there are over 50 people, and why were government workers told to come into work?
A couple of things. First of all, the regulations for organized events for 50 people or more. In most conventional work environments, if people aren't congregating into one meeting room, they should be able to continue to function. Secondly, we can't shut down the entire economy, and we certainly can't shut down the entire government. I do know that the Public Service Commission is working with the Deputy Minister to Executive Council on plans for further to facilitate more work from home wherever possible, but about half of the people employed through the Alberta Public Service deliver frontline services. So it's precisely at a time like this that the government cannot shut down. It has to continue to provide those services. And as I say, the Public Service Commission is working with Executive Council on plans to allow for more work from home.
Do you have a follow-up, Emma?
If people are, say, 60 years old or 65 years old and they're concerned that they're being told by their employer, whether it be the government or otherwise, that they should come into work, what's your advice to those people? Should they go in or should they not?
Well, look, I think Dr. Hinshaw's advice, first of all, is that anybody who feels any symptoms of cold or flu must stay home. And secondly, that elderly people or folks who are immunocompromised or have pre-existing respiratory illnesses should also generally try to stay home at this time. But I'm going to refer more technical questions on that to Dr. Hinshaw, who will be up here in a couple of hours.
Let's go back to the floor. Dean?
You asked the Prime Minister a letter this week for more medical supplies, masks, that sort of thing. What should we take from that? Is there
we actually, Alberta Health Services advises us that they have adequate supplies to deal with this crisis. Let me commend them and their management for having been quite forward-looking in stockpiling an enormous inventory of personal protection equipment, and other equipment. In fact, when the virus first broke out in China in January, AHS immediately purchased an additional 50 ventilators that we have not yet received, but they are effectively en route to Alberta. We'll be receiving them this spring. And the Minister of Health himself, Minister Shandro, has inspected the AHS warehouse and seen that there is a huge stockpile of this material. Now, having said that, management has to be very prudent about how much of that equipment they release and when, because the critical thing is that we have adequate equipment when we reach the peak of the virus later this spring as anticipated. But we're confident we have enough equipment. Of course, what the letter to the Prime Minister was about is it's better to be safe than sorry, and if we can continue to stockpile equipment of that nature, it will add to our confidence level. And I should say, of course, Dr. Hinshaw will comment on this more knowledgeably, but it should not be a secret to people that this virus is going to go away in the next few weeks or a couple of months. And so we need to start planning for the mid to long term. And that's one of the reasons we're asking for federal assistance with more equipment.
If I can just follow that, it sounds like you've been given a bit of a broad timeline. I know it's hard to forecast the future here, but what have the medical officials told you about how this is going to play out? Like a peak in May or something? Or?
Well, we've had a briefing on that, but I'm not going to get into technical issues like that. I should not improvise on that. I'll leave it to Dr. Hinshaw, and I'm not sure about her level of confidence on projections. But let me say that I think we could lay people understand that flus and colds diminish in the summer months with warm weather, and I think we would all expect that to happen in this case.
Just one broad kind of question, just in the general public hears terms like a state of public health emergency that can bring a fair bit of unease, even more so than what they're already feeling. What do you say to them about this declaration and what that means?
It means that the government is prepared to do what is necessary to keep people safe. That's all it means. People should be careful, they should be responsible, but they should be confident. They should be confident that we live in one of the best organized places on earth. We have some of the greatest professionals, and in Alberta in particular. I made this point when we started down this road 10 days ago that we have had very strong planning. We have a robust pandemic plan for the government of Alberta that was exercised just last November. We've been through a couple of very large-scale natural disasters in recent years, which has brought a very high level of interagency and intergovernmental cooperation. And I think we are as well prepared as any place on earth to deal with this. The additional authorities that we brought in today will help us as we face the challenge in the weeks to come. And with that, folks, I've got to get up to the legislature. Thank you.